All right, so we're going to start off sitting, and you've got the hammer, right? Okay, good, excellent. So we have two tools here, and this is really all you need, is a reflex hammer. If you're good, you can use your hand, and this is a paper clip for sharp sensation. If you don't have this, then sometimes if you have Q-tips, non-sterile Q-tips that we have like at the Chang Center in every drawer, I'll break a Q-tip, and there's a sharp edge on that, right, from the wood. So the wood Q-tips. Okay, so very quickly, I'm going to do history, all right? So how are you doing? I have washed my hands, okay? Hi, I'm Dr. Chang. Thanks for coming in today. I noticed that your chief concern is that you have some low back pain. Is that correct?
Correct.
And how old are you?
29.
29. And what do you do for your occupation?
Athletic trainer.
You're an athletic trainer. That's awesome. And are you active at all?
Mm-hmm.
Yeah? What are the things you like to do?
Just lifting and running like 4 to 5 times a week.
Excellent. So that's great. That's great. It's great that you have that emphasis on fitness. So tell me, when did this back pain start?
It's been off and on for a few years, but mostly about 3 months ago when it ramped up a little bit.
It did. And what were you doing when you noticed that it ramped up?
It was the day after we were doing legs in the weight room, and
Can you guys hear him?
No.
Ah. Hang on. Sorry, guys. Okay. So, what he has said so far is that it's been off and on for years, but for the last 3 months, it's kind of ramped up. And he's an athletic trainer, and he likes to lift weights and run. And, okay, and I said, what were you doing when it began to ramp up?
the day after leg day in the gym, I felt that I was really sore in my hamstrings. Primarily that day we were doing straight leg deadlifts. And once the soreness from the hamstrings started going away, I noticed that the back pain increased a lot, and it hasn't really gotten better since then.
So I'm not really familiar with what a straight leg deadlift is. Could you demonstrate that to me? Do not be afraid to ask your patient what they were doing when they hurt, because we're not going to know everything about everything, right? So don't fall off the platform, please.
Feet are about shoulder width apart, and what I'm doing is I'm not locking my legs out completely, just a little tiny bend, and holding an Olympic bar. I'm bending down at the hips, coming down, and when I feel a stretch in the hamstring, come up, and I'm externally rotating my feet, and then I'm squeezing my glutes at the top. So it's primarily an eccentric hamstring strengthening exercise, but also a glute exercise. On the way up, I'm trying to externally rotate my feet and then squeeze my glutes at the top.
Okay, thank you for showing me that. I appreciate it. So, and then after that, you've had pain ever since?
Yes.
And does it, when does it really get worse for you now? Does it get worse when you're sitting or standing?
I wake up with it most days. I wake up with it most days, and then throughout the day, it's off and on. If I'm seated for a long time, then yes, I have to stand up and move around a little bit.
Does the pain move anywhere?
No, it's either, it translates from left to right side of my back, but it doesn't go down my legs at all.
It does. Do you feel weak at all?
No.
And have you had a fever? Have you had any weight loss, any decreased appetite?
No.
Otherwise pretty healthy?
Yes.
Does it? Yes. Yes. Does the pain wake you up at night?
It has a couple times, but it's not very often.
And do you have any problems controlling your ability to go to the bathroom, number 1 or number 2?
No.
Any numbness or tingling in your legs?
No.
Any other questions you guys would ask? Okay, so we took a little bit of time passing it through, but it doesn't take very long to do a history. Okay, so now I know what I'm going to look at and particularly focus on, but we're going to do the exam. Sorry. Okay, so I'm going to stand off to the side just a little bit, but first of all, I am going to test your sensation, and I talk through it with my patients as well. So medial knee, Is L3 to me? Do you feel this okay?
Yes.
Oh, by the way, would you mind taking off your socks and shoes?
Sure.
Thank you. Sorry. Usually when I'm asking the history, I have them take off whatever I need them to unrobe or undress so that I can examine them. So I'm going to step down here because it's actually almost like I'm in a stool. Okay. All right, can you see me? Good? You let me know, Josh, okay? Does that feel the same to you? Okay, and how about here?
Yep.
And how about here?
Yep.
And how about here?
Yep.
Nice, okay. Now, that's light touch, right? And if it was some difference, I would check it again with a sharp touch. So I'd do it again, L3, how's that feel? And how about here? L4,
Okay.
L5,
That's fine.
S1. Okay, good. Now, strength. Let me move the microphone up, guys. I'm sorry. All right, so big toe up, give me resistance. Give me resistance. Good. Push down. That's S1. That's S1. The big toes were L5. Pull up. Pull up. L4. Yeah. Kick out. L3, 4. Kick out. Good. All right. Lift this hip up. Don't push down. 1, 2. And then on this side. Very good. Okay. Now, can you guys still hear me? Because this microphone's moving around. You guys okay? Okay. Slump test. Okay, so slowly extend your leg. Excellent. Pull your toes towards your nose. Good. Drop your chin down to your chest. Lean forward towards me. Do you feel any pain in your back or down the back of your leg or coming down into your foot?
Just a stretch.
Just a stretch. Excellent. Okay, relax for me then. And we'll do it on this side as well. Pull your toes up, chin down to your chest, and lean forward.
This one's a little tighter, but still
A little bit
stretch.
tighter. Okay. And which side do you have more tightness in one side or the other in terms of your back, your buttocks, or your hamstring?
I'd say normally it's the left. It's a little bit worse.
Left, a little bit worse. Okay. So then reflexes. So patella reflex. Patella reflex. Now, I have plenty of kids that I can't do these on. Okay? So what do? I let them play with their phone. Oh, sorry. I let them play with their phone while I'm doing this sometimes, so it distracts them. Or, so put your hands together, pull apart. Okay, turn your head to the left. I want you to spell California backwards.
A-I-N, bunch of letters.
Yeah, so I can oftentimes do that. Or what I'll do is I'll put your hands apart, pull apart. Okay, so give me a little bit of pressure against my hand. Just too much, too much. Good. So when he's extending his tendon a little bit, I can often get it much easier. Look at that. See how much easier that is? Okay. Give me a little bit of pressure, still pull your arms apart, and still spell California backwards. Okay. Did you see that one? Okay. All right. S1, same thing. You put a little bit of dorsiflexion, and you get that reflex here. Okay? Hard to get the hamstring when they're sitting, because they've got this pressure, right, on their hamstring belly, so I don't ever do it sitting. Okay, would you mind lying on your back for me?
Sure.
Thanks. Actually, could you put your head here? That'll be easier for the camera. Wonderful. Okay. So I guess let me come over here. A little bit easier. So just relax for me. So the first thing I do is I'm going to check your hip range of motion. External rotation should be about 60. Internal rotation 15 to 30. Any pain in your hip when I do that? And I check my popliteal angle or my hamstring flexibility, okay? So this is 90. If Michael could do it, this is 180. So 45 is in between. So he's probably about, what would you guys say? 60. All right? All right, any problems? Good. I'm going to relax him back down. Now I'm going to do my straight leg raise. Is there any pain that goes down your leg? Nope. No? Okay, so let's say he says yes. I've got pain down my leg. Then what do? It's called a Lesage test. I lower it a little bit. Tell me when your pain goes away.
There.
Okay. Does it come back when I do this?
Yes.
Yeah. He's lying. He's not having any, but he's playing with me. Okay. So that's and then what I'll do sometimes is the common peroneal nerve sits right behind the biceps femoris tendon. I'll strum this nerve, it's called a bowstring test, and see whether or not it hurts or recreates radicular pain. These are just little things. You don't have to do them. Okay, good. So I'm going to relax there. Excellent. Okay. Now I'm going to have you flip over on your stomach for me. Of course, I'm going to, do the other leg to compare. Excellent. All right. Are you pretty comfortable? Yeah. I'm sorry, we don't have a pillow for you. Okay. Quadriceps tightness. We would love to have the heel to the butt. It's not bad. This is the femoral nerve stretch test, where you grab the knee and you extend here. Okay? Now, ideally for you, Michael, would you mind moving closer to me? This is what you want to do so you don't hurt your back. Okay? Physician, take care of yourself first, right? A little bit easier for me to do that. All right. No pain? Okay. Now, how about now this is the other position that you can test then, the hamstring tendon. Okay? And so you relax the leg a little bit, just like that, and then put your thumb on the tendon itself and feel it jump under you. This is a little bit tougher. I like to do it on the side. Do me a favor and turn towards the audience. Excellent. Okay, just bend your legs for me. Drop this over. This is how I like to do it. Put a finger on the biceps femoris tendon, and it's going to jump underneath your thumb. Can you see that, Josh? Do you guys see my finger jump? Wow, I can feel it. Did you guys see that? Can you see that? Cool. Okay, that's L5 reflex, okay? Now you're going to be prone again. So you can do that before he spins. So in this position, you can really check hamstring. If you're worried about L5-S1 weakness, you can check the strength here. Don't let me push down. Good. And on this side, don't let me push down. Good. Okay? If you had a hard time checking the S1 reflex, you could do it here. Shimmy your body down a little bit towards the bottom of the table. There we go. Let me know about the time, Carlin, wherever you are. Okay. So you could do it here, too, as well when he's prone. He doesn't know what you're doing. You could check come down a little bit more. Sorry. Good. Okay. It's a hard table, so he's probably not happy. Well, see, it's hard. He's not a good. Okay, push down on my hand a little bit. Too much, a little bit. There you go. No, he was better sitting. Okay, move all the way up. But that's just another way you can check the Achilles. All right, good. Now do me a favor and pretend you're watching TV. Like get up on your, okay, good. And does that bother you at all in your back?
No, but if I'm doing this normally after like 5 minutes, it will.
Yeah? Can you push up a little bit higher? Any pain? No?
A little bit.
A little bit. Okay, a little bit of pain there. So I want you localize then. So then this is the part where I start to palpate, and I'll observe as well. So we know that the top of the iliac crest is L4, okay? So I'm going to palpate. Do you have any pain when I'm palpating down the center spine? No. Okay. Then I can palpate on the SI joints. Is there any pain on the SI joints?
A little bit.
A little bit on the left side. And how about on the right side?
Less.
Less, okay. I can get into the sciatic notch where the sciatic nerve goes, right, in the piriformis. Any pain when I push here? No. Okay, good. Excellent. All right. So now what I'm going to have you do is turn on your side and then get up. There you go. Good. All right. And then stand up for me, please. All right. Good. So what I'm going to have you do is face that wall. Is that good? You let me know. And I'm going to have him go down, forward flexion, as far as you can until you have pain. So while you're here, and especially when you're dealing with your kids and adolescents, this is a good test. Look at the paraspinals, make sure that there's not a hump, and you can check for any curvature there, okay? Come on up for me. Does that bother you at all?
Way down a little bit.
On the way down it bothered you. And where did it bother you? Here, or your SI joint, or in your hamstring? SI joint, okay. Okay, go ahead and hold on to your shirt for me, please. Okay, so what I want to do in this case, I'm going to turn a little bit this way. Is that good, Josh? So when we're looking at, turn this way first. When they're standing is a good way to take a look and see how much lordosis there is, right? If there's an anterior pelvic thrust, right? Because you can see a sense of the posture. Now, do me a favor. I'm sorry that you're my model, but I'm going to push on your head. Do you see how he's moving through the spine when I load here? See how there's this motion going on through here? Now, do me a favor and pull your belly button into the back of your spine. Good. Pull your shoulders back for me a little bit. Just drop them there. Now, bring your neck, and let's get you in good alignment. I know it feels funny to you, all right? But now I'm going to push. He's solid. Yeah? So we're talking about spine support and spine health. And this is what we're talking about when we're saying developing the strength and balance of the body. Okay, sorry, I just kind of went off topic a little bit, sorry. Okay, sorry, turn this way. Now, he did forward flexion. Go ahead and do right side bend. So what you're looking for is a nice curvature of the spine. If they've got paraspinal muscle tightness or they've got a disc injury, they're going to be really straight here and they're only going to curve here. Okay, and now side bend to the left. Excellent. Okay, now extend back for me. So you see he's kind of moving here, not so much lower. Does that hurt you at all to do that?
A little discomfort.
Does it hurt right there?
A little discomfort, but not a whole lot.
Not too much. Okay, good. And then you can do rotation, right? And then rotation extension and lean backwards. Does that hurt on your right side or left side?
Right side.
Right side. How about this way and extend?
Yeah.
And left side or right side?
Left.
Okay, hang on to your t-shirt, your shirt again. So this is the Gillette test. Oh, hold it up a little more. Great. So I put my fingers on his posterior superior iliac spine, which are right here. Okay. So I want you to march, meaning bring your left knee up like you're marching, bring it at 90 degrees, and back down. Can you get this, Josh? Okay. Now your right one. Okay, and back down. So he's not moving very well on either. Okay, unfortunately, I wish one of them was moving better than the other, so you had to demonstrate. So do it again for me, left one up. So he's staying pretty level, and he should be doing this. Okay? Okay, back down, and then the right one. The right one's moving actually a little bit better than the left one, but still not great. Okay, this is called the Gillette test, all right? Now, one-legged extension is when you stand on the left leg for me. Now extend. Back. Arch your back. There you go. So look, he doesn't move. See where his fulcrum is? It's not down in the lower lumbar spine. It's in the upper lumbar spine, almost at the tail junction. Okay, relax for me. So I think I know what his problem is. Okay, so go and walk on your toes away from me. And come back and walk on your heels. Excellent, good. So do me a favor. And what you're going to do is you're going to just put your bottom in and you're going to lie back and hug your knees. Okay, so this is the Thomas test. Okay, lie back. Hug your knees to your chest. Good. So let this leg drop. Got it? Make sure his back is flat. And are you relaxed? Just relax. Okay, so what are we seeing here? Hip flexor is tight, right? He's not level with the bed. This is his rectus femoris. The rectus femoris is also a major hip flexor, but it starts at the hip, crosses two joints, then crosses the knee. He should be hanging down like that, but he's not, right? Someone who's flexible, they're like a grandfather clock. You can move them, all right? So he's tight in his hip flexors, both the psoas, and where does the psoas muscle attach? Lumbar spine, transverse processes, right? That's probably why he's not moving, because he's so tight up front. Now switch. Got it? And if they have knee pain, then have him grab here, grab on your thigh, posterior thigh, pull that way. Okay, that way they're not compressing their patellofemoral joint. Back flat, Michael, and then let this drop. Same thing. So he's got the SI joint dysfunction. That was one of our cases. Okay, stand up for me. Because why? Right? We know it's not radicular. So this is a non-radicular source of back pain. We know it's not a systemic reason, right? He doesn't have a fever, he doesn't have chills. He doesn't have, he's a pretty healthy guy. You know, I didn't go through the medications or whether or not it's a history of cancer or whether or not he's used IV drugs, whether or not he's on prolonged steroid use. I mean, those are all the questions you could ask, but in a young, healthy person, you go through that medical history, right? But he had a positive Gillette test. His hamstrings were tight, but Thomas' test showed really tight hip flexors. So what's that going to do? And you saw his posture, right? He's got an anteriorly tilted pelvis. I guess he's got an anteriorly tilted pelvis, right? And that's causing what we had talked about on one of those slides where because of that, then when he's trying to lift weights, even sitting down, that pelvis should tilt. But if it's anterior, he's putting a lot of strain on his hamstrings doing the deadlifts that you were doing, okay? So what's his treatment going to be? Physical therapy, stretching, right? If he's in a position, now he's an athletic trainer, so I would assume he moves around a lot, but there's, you know, you can be, he may have a primarily sitting position what he's doing now. So I'd say, you know, you need to stand upright. You know, sleeping position. A lot of people like to sleep in a ball at night. So if you're sitting during the day and you're sleeping curled up during the night, when does that hip flexor have time to stretch out and relax? The gym. So we're talking about 23 hours a day shortened versus 1 hour a day at the gym, right? So you've got to change everyday behavior. All right?